To all, I'd like to call to order the Town of Hilton Head Community Service and Public Safety Committee meeting for today, which is March 28th at 10 a.m. Krista, are we compliant with FOIA?
Yes, sir, we are.
Thank you. Would you please do a roll call?
Yes, sir. Mr. Ames?
Here.
Mr. Lennox?
Here.
Mr. Harkins?
Here.
Mrs. Becker is absent today, sir. All present.
Thank you. We have before us the approval of the minutes for our last meeting on February 28th. Is there a motion and a second for approval?
Move to approve as presented.
Second. All those in favor?
Aye.
So, Krista, appearance by citizens. Do we have any citizens that have expressed interest in coming forward today?
No, sir, I have no citizens signed up to address the committee today.
Thank you. So we'll move on now to new business. The first item on the agenda, the Beaufort County Sheriff's Quarterly Crime Statistics. Major Angela, welcome.
Thank you. Good
How are you
morning.
this morning?
I am good. How are you guys doing? I'm not going to go through this page by page this morning. I think everybody's probably had a chance to review it. If there's anything significant in there that you guys would like to ask about specifically or any questions regarding law enforcement in the community, I'd be happy to hear from you.
Members of the committee, Tom?
Yes, good report. Since your last report, have you seen any unfavorable trends?
Unfavorable trends. Well, we actually had a conversation this morning with Fire Rescue discussing the reemergence of our opioid drug activity here on the island and in Beaufort County. Historically, I think 2018-ish, we saw a lot of overdose deaths and overdose response calls based on basically fentanyl. There was the drug folks kind of clamped down on some of the manufacturing and prescriptions. Heroin made its self-known again back in our area, and a lot of folks began pressing artificial pills. So hydrocodone, oxycodone, things like that were being pressed or basically manufactured at the street level, not by pharmaceutical companies. And they were using designer drugs, specifically fentanyl, to create the same feeling that you would get from a prescription drug. That kind of went away for a while, but in the last 6 or 8 months, we've seen a great uptick again in opioid-related drug overdoses and fentanyl overdoses. Fentanyl has made its way into our heroin samples that we're pulling off the street. We were discussing a case that we're working alongside another federal agency where we had conducted controlled purchases of cocaine and methamphetamines, and the dealer actually gave us an 8-ball, which is about this much, of fentanyl, and said, see what you can do with that. So the drug trend has definitely, opioid-related overdoses has reemerged. We've been dealing with now for the last 8 or 9 months car break-ins. I know every time I come here I talk about that. If people would just lock their doors and lock their homes and take their keys out of their cars, and other than that, that's what we've got going on.
Following up on Mr. Lennox's question, what are the demographics of drug use, and are there differences between the drugs?
Is specifically
Age related. I'm really trying to figure out, are there areas of our community that are susceptible to more drug use than others? And I'm really trying to figure out whether or not there's something the town can do. So.
Yeah, I can't say that without doing a little bit of research. I will tell you that we respond to overdose deaths behind gated communities. We respond to overdose deaths in gas station parking lots. We don't see as much of the overdose-related activity in the tri-community area. So
What's
I
the
don't think
tri-community area?
that would be what the lower income housing areas. Sandalwood Terrace, Hilton Gardens, the Oaks. But we've responded to overdose deaths in Indigo Run. We've had overdose deaths in Hilton Plantation. So can I say that it falls on
No, that's-
one demographic versus the other? I can't without doing any other research.
Okay. One other question. The town is focused on short-term rentals at this point, and there's a lot of discussion among the community when they talk about noise abuse, party abuse, and so on and so forth late at night. They call the sheriff's office and try to get some attention. What's a realistic expectation for our community regarding a response time?
And when you're speaking of noise complaints, are you talking being generated by businesses, or are you talking
No, I'm
generated by?
I'm primarily visitors who are in a short-term rental enjoying themselves after 10 o'clock at night.
Okay, okay. So typically, what our response to that would be this. We'd respond, if the complainant, i.e. the person that is calling, wants to meet with law enforcement prior to, then we will engage them and find out what the complaint is. We'll go to the origin of the noise, tell them to turn it down, try and gain some compliance, find out who's in charge, and then we'll leave. It may be a warning, written warning would be issued, but typically not. If there is a repeat call, i.e. we leave the area and they crank the music up, which it happens, we ask that the complainant or the person that is being disturbed by the noise or the party meet with a deputy. They're going to have to agree to come to court and bear witness to what they've observed, write a written statement, and then we would cite the person that was in charge.
Thank you very much.
Major, could you share with us how you're doing in terms of being fully staffed, and what you're doing in terms of recruitment, and what impediments you may be facing in terms of recruitment?
Okay, so currently, south of the Broad River, and I can only speak of the personnel that I manage, our shifts are down at least 2 per team. A team is topped out at 12, okay? So we're down 8 at least, sometimes 10. Let's throw on the fact that we may have folks that are on military deployment, which we have 2 that are currently deployed on year-long tours. Folks that may be injured and duty-related injuries, and folks that we may have at the Criminal Justice Academy. That kind of magnifies what you look at on paper as 10 people short. It makes it 16 people short. We backfill those positions with overtime so that we accommodate the necessities of both Hilton Head and Bluffton. So we post overtime. The guys do buddy swaps for vacation. But we're able to fulfill the mission that we have as a law enforcement agency. As far as recruiting goes, I think we have 6 people that are coming before our hiring board today. And we have actually modified our hiring process so that we get them in the front door early, do the interview, which is something that usually happens on the tail end after we've sent them for a mental eval. They've gone through firearms and health screening and polygraph and all that other stuff. And the interview is usually the last thing. We do the interview first to try and weed out some folks that we know are not going to be good qualified candidates based on their life experiences and whatnot, so that we can fast track the hiring procedure. What used to take 2 or 3 months from the time that we received an application until we got a body in the door is now been crunched down to 4 weeks before we can make a conditional offer of employment. Law enforcement, trending nationwide, is short-staffed. We're not the only agency that's short. A lot of that has to do with the perception of law enforcement these days and the way, a lot of community members see us. Nobody wants to take that abuse. A good day is, thank you for your service. If you hear it once a week, it's made my week. It's very uplifting, but we're at this point. A lot of the young guys, especially with the retirement system in South Carolina, has adjusted itself a little bit. For me, I stayed 25 years, and I'm going to retire at, my percentage goes up. I'm moving into my 26th year. I don't have to be here anymore, but I'd actually like my job. But the younger guys are facing a retirement system that is working against them. You know, there's no benefit to it right now. The people that are coming to us that want to be police officers want to be in public safety, and they want to do the job to serve their community. We have upstaffed our recruiting. We now have Sergeant Rao and Sergeant Saranka that are both aggressively recruiting. They're making appearances at the military bases when they're doing their, I don't know what the proper term is, their exit interview or of sorts. I'm not sure what it's called, but we have definitely taken some steps here in the last 6 months and revised our recruiting program to be more aggressive in bringing qualified candidates in. So,
Well, on behalf of the community, we appreciate what you're doing, and we thank you for what you're doing.
thank you. Thank you.
Follow up?
Oh, certainly.
I'm wearing my affordable workforce hat at the moment. What does a deputy recently hired earn in Beaufort County Sheriff's Department?
So a recently hired deputy, we just, in the last 2 months, raised the starting salary to, I think, around $47,000.
Thank you.
Okay, with that, you get adjustments for bilingual capabilities. You get adjustments for every degree level that you have. Starting with an associate's degree, you get a 3% bump. Bachelor's degree, you get a 6% bump. Master's, so on and so forth. If you're hired with experience, there's a scale that will adjust your starting salary. What we have found recently is that we had extended an offer of employment to a deputy that was moving here from the northern part of the United States, and when he started looking for housing, realized that he couldn't afford to live here, and he had to decline the offer of employment. The town stipend does wonders for our folks. It's still, you know, for a 23-year-old person that is raring to go and wanting to come to work here with student loan, car payment, rent, you've got to have some other means of support. You're going to work yourself to death with overtime to try and basically, you know, live from day to day. So.
Thank you for your service.
And we have to live in Beaufort County. We can't live outside the county.
So as a point of reference, someone making $50,000 a year can afford about $1,300 a month in rent.
If you
Good
know
luck
any,
in-
if you know any places that are
Yeah.
renting for $1,300 a month, please send them my way.
It's not here.
Yeah, so,
Real problem. Major, thank you very much, and
You're
thank
welcome.
to all your colleagues.
thank you.
The next item on the agenda is the Fire and Rescue 2021 Annual Report. Chief? Good morning.
Good morning to the committee. Thank you. Brad Tadlock, Fire Chief. I'm going to turn it over to Deputy Chief Blankenship for the presentation in just a second, but I wanted to highlight a couple things real quick to catch you up a little bit. So first of all, last week we were in Orlando, Florida. We had a meeting before the Fire Commission on accreditation, and we received a positive vote last Wednesday. So we will be coming forth with our award at a council meeting. Town manager is going to set up for us to present that to the town council at a future meeting here coming up. So good news there. Yeah, that it was a good accomplishment for the team. And before we go into the review of 2021, I just wanted to highlight real quick, since we're in person again, that what fire rescue and the town staff has done through the pandemic, because I think sometimes it's lost a little bit on what we've accomplished. So going back to the summer of 2020, we did, if you recall, I know a lot of people want to move past this, but I think it's important to highlight it real quick. We did 2 mass testing events, coordinated through Tom Dunn, the town, held at the schools. We were all unsure of what was happening in the pandemic, but we knew we had to do testing, and that was the first initiative. So then we moved into the fall of 2020, and I talked to the hospital, and we said, what do you need to support the hospital. The community testing at this point had ramped up to the drive-through type testing at the hospital. So Jeremy Clark at the time said, we need staffing. So Fire Rescue provided 2 persons at that drive-through testing line 5 days a week from late November of 2020 through March of 2021. And we started that with a contract through DHEC, which we could not get done. Eventually, the town manager at the time said, just go start helping them. We'll worry about getting the contract, because Tom Dunn worked on the contract with DHEC for over a month and a half, and we could not get it through the process. So eventually we did, and we got reimbursed for that time. But for several months, regardless of the weather, we made sure Fire Rescue had 2 people supporting the community testing line up at the hospital. So then the vaccines came out in the spring of 21. And there again, the vaccine started. They moved the vaccine clinic off island, but we did what we could to support that. And then as the vaccines became more available through the spring of 21, the town, with town support, Aaron was here, Carolyn's here, we did 9 pop-up vaccine sites at different spots to help support the vaccine through the summer of 21. So then we moved into late summer of 21, and here come the Delta variant. And as I was looking at the trends overseas, you could tell something was happening. So we started reaching out to DHEC. At the time, the only testing was over in Bluffton at the Tanger outlet. So that's where we talked to DHEC, and through some negotiations, we got them to show up and start testing on Mondays at Station 4, if you recall. And we held that all through the fall, and it worked pretty well. Then here we go, just when we think things are getting better, here comes the uptick in the wintertime. So there again, with town staff, Aaron, and communications through Carolyn, Tom Dunn, emergency management, we were able to get with a private vendor that set up in Chaplin Park and administered the testing there through when it started to downturn here in February. So I just think Fire Rescue's been out at the tip of the spear on that. We've had our own families, had illness. We were short people due to the pandemic, like the sheriff's office. We were short people. We were forcing overtime. Their family members were sick. Then we had our most people go out during the Delta and then in the winter due to the spread. So hats off to the team. I think we've done a lot to support the community. We've done a lot as far as the town and the Fire Rescue and facilities, as far as any jurisdiction in our area, as far as getting out and trying to help with vaccines, with testing. So I think I just wanted to recap that, and hats off to my team for all they've done over the past 2 years, and thank you all for your support in that too. I think we've done a good job for the community. It's been up and down, but I appreciate what everyone's done. So with that,
Before you leave, any comments?
Brad, we're 2.5 years into this pandemic. In the emergency management manual, is there a chapter called pandemic?
yes, there is. There was one before the pandemic. It primarily dealt with how are you going to operate when your staffing is out? Whether it's a different type of flu pandemic. But there is a manual. We've updated the manual during the pandemic, and we're going to update it again once we're really clear of it. We don't want to get ahead of ourselves, but yeah, there is an annex. We've learned a lot through it. I think, you got to be resilient. We've seen when we shifted gears a little bit in the beginning when everything slowed down, and we've reopened, and how we handle it and try to limit the spread. So
I think you've done an incredible job. Looking back over the last 2.5 years, what surprised you the most?
Surprised me? I think just well, I don't know if anything surprised me. It was one turn after the other where you stopped, you adjusted. We went from mass testing to community testing.
I think what surprised me the most was the consistent uncertainty that we lived through. And I think the job that you all did and the Beaufort County Sheriff's Office in public safety gave me a lot of confidence in the environment and the community we lived in. So to the Sheriff's Office and to Fire Rescue, absolutely fantastic job for giving the community the confidence to get through this.
Thank you. Like I said, I think we, as a town government and as Fire Rescue, we did a lot to support the community. Had to push and pull the state a little bit at that level to get some things, but I think did what we could based on our staffing and things like that. So I appreciate those comments. Thank you. I'll turn it over to Deputy Chief
Well
Blankenship.
done, thank you.
Thanks.
Hello,
Good
Chief
morning.
Blankenship, welcome.
Thank you. I'm just going to go through our annual report here for 2021, and please feel free to stop me along the way, but I do have a place for questions at the end. All right, so looking at total incidents for calendar year 2021, the graph on your left there shows a 3-year. So as you can remember from our last time we met with you guys, we did see a decrease from 2019 to 2020 of about 2.16%. We attributed that a lot to the when COVID first started in early 2020, we really stopped running calls for about 2 months. We really shut down when the economy shut down. So we saw a downtick, but then once we opened back up, everything came back to life, we really started running calls again. And as you can see, in 2021, we had a 13.1% increase over the year 2020, and that will really show when we get into a graph here in a bit about the summer months and our tourism uptick. On the right, you'll see a 20-year incident count. We started tracking this last year, looking back. 2001 is when I started, so I wanted to kind of look at what we were doing back then with roughly the same amount of staffing as we were doing today. You can see the blue here is our total call volume. You can see as we go through the years, the EMS really just continues to grow. We run about the same amount of fire calls and other related calls over the 20 years, but EMS really starts to take off. And I think that's in part to our aging community here on Hilton Head and our increased tourism. What you'll see here is this little bump up from 2020 to 2021 in fire. And what that represents is in November of 2021, we started running our yard waste burn day checks that we do as actual calls. So someone calls in a yard burn that day, we actually send a truck out there to check it. And we do that, we did it 370 times in 2021. So we're actually tracking those as calls now. So this will be kind of be our new norm. Like I said, we run just under 400 of those. But they are a call to us. We do respond out. We do provide a public service, so they should be categorized as calls. We had just never done that before.
Chief, not for today's meeting, but it would be interesting to do a budget overlay of that chart, just to see how you've optimized your resources. Because I would bet that your resources did not increase by 61%, but your throughput did.
You're absolutely correct. I can do that though. But no,
Yeah.
we run about the same operating budget for the last, I don't know how many years, Chief? I know it's been the last 5 years I've been up here. It's been roughly the same with about a 3% increase.
There's a good story behind that data.
Good. Calls for service by days of the week, 2021, you're looking at the green. You can see obviously in 2021 our calls went up across every day of the week. And then by service hour, you can see daylight hours, we tend to run more calls. We tail off in the overnight hours, and this just goes to show too that we have our coverage crew that runs from 7 a.m. to 5 p.m. Monday through Friday on a 4-day work week. So we have an extra crew on during those daylight hours. Calls for service by month. So here in 2021, you're transitioning to the orange. And like I said, in 2020, you can see this dip here in April. That's when the society shut down basically for COVID. And then we started working our way back up through the summer months. When we opened back up, we saw consistent numbers from that we were running in 2019. And then fast forward to 2021, when we really didn't slow down and we just kept going. You can see your June, July, August, September is really spiked. So 2021 tourist season, as we like to call it during the summer, really spiked over the previous years. And looking at everything, how this year's going to be, I think you're going to see similar numbers to 2021, if not more. Our fire responses by planning zone. So our 7 stations, and I labeled them here. I know you guys asked last time which stations represented which communities. So Station 1 in Shipyard, Station 5 Hilton Head Plantation. Where you can see the big difference here is 2021 looks a lot like 2019 when it comes to fire response. 2020 was low because during most of 2020, we stopped running fire engines to medical calls. We really cut back. We started asking more questions on medical calls. We really wanted to alleviate how many people we had on scene. So we were only sending medic units primary to those calls. We've since went back to our normal operating, and you can see here that we're pretty much looking at the same numbers as we did in 2019, where Engine 1 in Shipyard and Engine 5 at the front gate of Hilton Plantation running the vast majority of our calls. Total incidents by our service level. So for accreditation, we gauge our response on 4 different service levels: fire, EMS, rescue, and hazmat. That's the 4 service areas that they focus on. So that's how we're going to start presenting our information. Obviously, EMS is roughly 78% of what we do. This graph shows you exactly why. Fire was up a little bit in 2021. Rescue and hazmat all were up a little bit. Fires categorized 2021 single family. We were down from 2020. We're up in multifamily residential. Commercials were down. Brush, wildland, we're up a little bit across the board. That is our things that were actually on fire when we arrived. So single family residential, multifamily, all the way down to vehicle fires. This is our fire loss report. This is January through December of 2021. We report anything over $25,000 of loss or more. So you can see Legacy Court, this was a single family home. This was a lightning strike. We did confine it to the room of origin. Where you don't see the fire spread, these are going to be our 2 vehicle fires. 26 Allen Road, this was a single wide mobile home. Again, confined to the building, but that was a total loss, as well as our Right Place confined, but it was a total loss as well. 18 Oak Marsh was another single family. 48 Muddy Creek, I don't know if you guys remember this one, but was originally a single family that was added on to multiple times. I know the sheriff's office is very familiar with this address, has been there a lot too, but is basically broken up into several different apartments throughout, but that was a total loss. I know it wasn't a total loss. We saved a little bit of content on that one. Old Wild Horse Road, that was a mobile home, and then 211 Caesar Place, that was a total loss. That was a row house fire in the middle of a townhome at Caesar's Place. So not bad for 2021. We saved a lot. We always look at what we saved compared to just what we lost. So we had a lot of good savings in 2021.
Chief, how do you calculate the loss value?
So we use the pre-incident value. We use the county's assessed values if they exist. So unfortunately, mobile homes do not have that value. We can't get that. We've tried to get it from the county. So that's a best guesstimate of what the pre-incident value is. And then we do percentages of the occupancy and roughly what they can tell us, for content loss and stuff like that. But we try our best to use hard data that the county provides in our tax records and stuff like that for the pre-incident value.
Thank you.
And then it's just calculated by the percent lost. As Chief, stated earlier, accreditation is big in our world, and CFAI requires that we report on all of our service levels of our times. So we report on fire, EMS, hazmat, and rescue. I'm going to go through the fire and the EMS. Total response time. So in 2021, this is a gap analysis over here to the right. So our benchmarks for alarm handling is a minute 20. 90% of the time, and these are all based on 90th percentiles, to get rid of outliers. So we answered the call and dispatch unit 22 seconds faster than our benchmark, so at 58 seconds. Our turnout time, we're 26 seconds over. That's been very consistent through the 5 years, as you can see. One way we're looking to combat that is updated technology with our station alerting. There's a countywide initiative right now that's being funded through the CARES Act money at the county level that they are going to provide new station alerting to every fire station within the county. So we're working with the Beaufort County Fire Chiefs Association and EMD to get that RFP out and get that. So that will improve our technology within our stations. So right now our technology is 20 to 30 years old. It's good for us, but it can definitely be better. We know that there's gaps there. We know that from the time the dispatcher hits the button to the time it actually comes to the station, there could be about a 10 to 30-second delay over radio waves and stuff, so we've tracked that. So I think our turnout time, this is the best reflection we can get of what we have, but I think we do a better job here. Our travel time, 26 seconds over, that's about as good as we can get it. We've looked for years over emergency access gates. We've put them in. I would say with the increase of traffic, even though we have traffic preemptions at every traffic light, the congestion, I watched an engine company respond down Pope Avenue last Saturday and pulled out and watched the line of cars coming down Pope Avenue leaving Wingfest. That impacts travel time. So I don't know that we can do a whole lot better there. And then our total response time, we were 15 seconds over. So we will continue to look at these numbers. We'll continue to look at our benchmark times every time we update our SOC and annually to adjust those as needed.
Chief, in terms of the traffic signals, do you control those when you're on the road?
Yes, they're automatically controlled through GPS on the vehicle. So every one of our emergency vehicles has GPS associated, and as you're approaching those signals, they automatically change. We don't manually do it.
Thank you.
And then for EMS, same thing, alarm handling, we do very well. Turnout time, travel time, total response time, we're not meeting our benchmarks. So that's something we'll continually look at and try to improve. But I do think over the next year, with the implementing of the new station alerting, our turnout times will be a little bit better. As I spoke earlier, open burning that we've now, we're categorizing as service calls for us. We had 370 registered permits. Last year, we inspected, our crews went out on those burn days and inspected every single one of them. We issued 20 warnings, 7 citations, and we currently have 493 active permits. Some EMS data, again, I didn't put the plantations in here, but you can see when it comes to EMS, Station 1 and Station 5 at the front gate of Hilton Head Plantation continue to be our 2 busiest stations. My entire career here, 20 years, that's always been the case. Those are our 2 heavy hitters, with Main Street corridor being a lot of the nursing homes and stuff, and Station 1 having a lot of multifamilies in the really the tourist district. But what we see here is Station 4 continues every year to uptick in this. They're now our 3rd busiest, just shy of Station 1, and that's where last year I came and asked for 3 extra positions on the line. Those positions are going to be at Station 4 to now make that a split crew as well. So when that ambulance does go out, that fire truck still stays available. So Station 4 will be hopefully July 1st, when I can get some more paramedics through graduation. Station 4 will be responding the same way as Station 1 and Station 5 are. So even though that medic's so busy, that engine's still up and available.
Station 4 is Sea Pines?
No, I'm sorry. Station 4 is the back gate of Hilton Head Plantation.
all
And the
right.
reason we're seeing the uptake in the call volume there on the EMS side is largely in part to Bayshore. Bayshore, we average a response there every single day, if not more. And then obviously the Cypress, and it also goes to our aging community. People live longer here, and we started putting the these assisted livings back in the early 80s, and they're full. They're all full, and people we're seeing that people are living longer, which requires us to provide them more care, which is a good thing. EMS calls by disposition, I threw this up. This is everyone that was that we basically responded to and filled out an electronic care report. So basically, this is a medic unit response that something was there. There was a patient there. It wasn't a no call. So 5,867 last year. But the thing that I really want to show right here is, out of that 5,867, 4,386 of them we transported to the hospital, no licensed sirens. So I know a lot of people think that we just run around the island, lights and sirens, and I know we mess up traffic when we do. A lot of that is to get there, to get to the patient, to see what's going wrong. But 4,386 times of that, the patient was stable enough to where we could transport them to the hospital without running emergent, which I think shows that our people are out there weighing the risk benefit, and they're doing a good job. lowering that risk by not responding licensed sirens to the hospital.
Just out of curiosity, it says no lights or siren, but when you're going to the patient, lights and sirens?
Yes, yep. And that's not all calls. So if it comes in and it's just a lift assist, which we do 500 to 700 times a year, those are calls that we've already determined you don't run lights and sirens to. So there are several calls that we don't, and this is just the disposition of to the hospital. The top 15 primary impressions last year, this is what basically the paramedic found when they got there, not what the caller said when they called 911, that what our people found when they got to the patient. Generalized weakness, kind of a catch-all, 493 of those. Head injuries, I can tell you, we already have talked this year, coming up on the first quarter, I think our number one primary is going to be fall with head injuries. Syncope, fainting, altered mental status. This just kind of goes down the line here just to show you what we're running to most of the time. But a lot of falls, a lot of injuries from falls.
Chief, would you elaborate on chest pain and your communication channel to the hospital for the value of the public?
Yes, so every call we get, we communicate with the hospital before we get there. So when it comes to chest pain, cardiac arrest, we have the ability in the field to basically do a 12-lead EKG, take an image of the heart, an electrical image of the heart, and we can actually send that to the hospital before we ever get there. So that's all via cell phone services, but our monitors can basically talk to that in the hospital. So if we call a code STEMI, which is an acute MI, that information can get relayed. The ER doctor can see it, the cath lab can see it, the cardiologist can see it before we ever get to the hospital. So basically, if they look at it and they agree, there's times when we wheel people straight through the emergency room right to the cath lab and they're ready and waiting. So I think that's a huge benefit for time savings on those critical calls. We like to report our cardiac arrest and attempted resuscitation. So for 2021, I don't know if you guys remember, but 2020, I don't know that, and don't quote me, I don't think we had any saves from witness cardiac arrest. So that was the height of COVID. That's when our people were suited up in these space uniform looking things, and we went in. There was not a lot of bystander CPR happening during that year. I think people were afraid. They were told not to do stuff, told not to get near patients. We didn't know if they had COVID. So 2021 comes around, first half of the year, we kind of saw a lot of the same stuff, but the second half of the year, we really started doing a little bit better. So we ended up with an 18% save rate over in 2021, which is still 8% over the national average, which is still great for what we're going through with COVID. We had a total of 5 survivors of the year, and I can tell you we're already doing better in 2022 than we did in all of 2021. So definitely getting back to normal, getting back to what we do. It's our bread and butter. It's what we're known for. 2 of our members just went to the Resuscitation Academy out in Seattle, Washington last week, and they couldn't believe how Hilton Head is talked about in that community of cardiac arrest saves. So we will get back there. As Captain Viens talked about earlier, the patients receiving is naloxone, which is the Narcan, which is who we give, the medication we give to all known or unknown overdoses. So to her point, 2018, we really saw a downtick to 39 to 35 of patients receiving those. In 2021, we're back up to 67. In the first quarter of 22, I don't have the number, but it's a lot. So we definitely are seeing the same thing that they're seeing on that side. We work in conjunction with them on this information. They respond to all of these calls with us.
Do you track how many calls for service you respond to along with the sheriff?
We don't, no. We don't track how many calls there are. There's different reasons we call them. I mean, we call them for traffic control. We call them for, if it's an unsafe scene, we'll allow them to go in first, everything, but we don't track how often we run together. I'd say it's a lot. I mean, they come to every one of our structure fires. They have an aspect of response with a lot of what we do. Interfacility transports and the hospital airport transports that we provide. I know we've talked about this every year. So we really saw the downtick in our interfacilities back in 2017 when we brought it up to the hospital. That's really not a service we thought we should be providing. 2019, we went up to 71, and we started having that conversation again. We were really on track with Jeremy, and then he left, and we've got back in the conversation with Joel. We really stopped. We were going down a route of, hey, we need to get out of this business. It takes one of our ambulances off the island for hours at a time because we're going to Charleston or we're going to Savannah. But along with that, it's also taking that fire engine out of service. So Joel has told us, and I believe the contract is in place, they have contracted now with a private ambulance service to provide a better coverage on Hilton Head. So we have seen these numbers, and in 2021 we had 54 interfacility transports. In the first quarter of 2022, I would say we've had far less than 10, I want to say. So we're definitely tracking it. We track every single one of them. We did give an extensive report on what it was, but we are starting to see that improve. And we wanted to come out of the pandemic. We knew the hospital was short-staffed as well, and all the private ambulances are. Again, they're going through the same thing we are. There's a nationwide shortage of paramedics. They're having difficulty hiring people the same as we are. But we think that this is an area we can really improve with the hospital and try to get out of this business. You guys last time asked for a percentage of the calls we run to our local residents compared to our total calls. So the best we can do for hard data is through our patient billing. So any medical call that we run that we actually treat the patient, it doesn't matter if we transport them or not, if we actually treat them, they get a bill. So 65% of our patients that receive a bill have a 29926 or 29928 billable address. So I was talking to Mr. Harkins earlier. This doesn't represent the percentage that we run to. So the 500 to 700 lift assists we do a year, that is mostly our residents. That's someone that's fallen in the shower, slipped out of bed, something to that effect. They don't receive a bill for that. So this is reflective of billable, but not reflective of the overall. I would say the overall is definitely higher than 65%. And then in 2021, we generated 1.77 million from billing.
If you monetize that, you can see what a value that we're given to our visitors by and large.
Yeah. I mean, we do. I mean, we do provide a very good service to our visitors. I mean, we provide it for our residents as well, but we do provide the same level of service.
And we don't follow them and bill them either.
Oh no, we bill them.
You do?
Oh yeah, no, yeah.
All right.
We bill visitors, we bill residents. Everyone gets a bill that is treated. Absolutely.
Okay.
Chief, of that 1.7, how much do you collect?
That is what we collected last year, which is 80% of what we billed, which if you look national average wise,
That's good.
is amazing.
That is amazing.
Amazing. But this again to our population that Medicare and Medicaid picks up a good majority of that. But no, that is actually the revenue that we brought in from billing, which is roughly 80%.
But an ambulance trip is reimbursed by, generally reimbursed by insurance, private insurance, as well as Medicaid and Medicare.
Yes, sir.
Thank you.
Our staffing in 2021, we hired 17 new firefighters. So just to remind you guys, back during the pandemic, really all of 2020, the fire academy and the EMT classes shut down. So we were a little behind then. Then we got a lot behind because we couldn't send people to school for it. So I've been working to get back. I'm currently have 4 vacant line positions, which is amazing because there was a time where I think we had 10 or 12 vacancies. So we're definitely getting back into that. Last year we had 5 retirements. We had 17 resignations, and I put this little note in here because you guys asked last time of where do they go? So an informal survey when they were leaving, I always ask them. So 10 left to take other jobs in the fire service. We had 1 leave to go be a dispatcher leave to go be a dispatcher somewhere else. Some moved back home to be closer to family and took fire department jobs. But 10 of the 17 did leave to take other jobs in the fire service. Some informed me that it was cheaper to live back home. They had family there. We know 1 left because he couldn't find, he was living in like a Econo Lodge in Bluffton, and he basically was like, I can't find anything and I can't afford to find anything.
Starting salary?
44.7 right now.
Chief, what percent of your employee base lives here on the island?
I think the last time we ran it, department-wide to include administration, dispatch, everything was 31%, but Angie would have to, HR would have to,
About 30%
About 30.
lives here or lives off island?
lives on the island.
Yeah, lives-
I'll tell you, out of my 7 I just hired, 4 of them are living in Savannah or Pooler. That's become the number one answer, or the question I get when I call to hire people is, do I have to live on the island and how far can I live? It's more affordable to live in
From
Pooler.
your view and the chief's view, in terms of the overall compensation package, are we competitive? We shy? We
I think if
over?
you look at what we do, doing fire and EMS, we're shy. I mean, I just heard Captain Viens said that their starting salary is now 47, I think. So, now I don't want to compare fire to cops, but you have to. I mean, we're looking at the same people that they're looking at military. We'd love to have military people. So people want to get into emergency services, police, fire, EMS. We're looking at the same thing. We're just over what a lot of neighboring departments are running, but they're only running fire. They don't have to get on an ambulance and run medical calls. So I just think the fact that we do both, and we're at the end of the road. We're on an island that, quite frankly, none of us can afford to live on anymore. I would also concur, if you can find housing at $1,300 a month, send that my way. I have some people that would love to take that. This says we're 2 dispatch positions short. We filled 1. They started today, so we're actually just 1 short there. And then 1 fire inspector is currently vacant, and we do have applications out for that. A quick update to our strategic plan. Goal 1, create the appropriate staffing model to fulfill the needs of the department and serve the community. Again, I'll touch on the fact that with you guys' approval of the 3 FTEs in last year's budget, we are able to move Station 4 to that split crew staffing model. I can tell you, to date, I have not been able to do that because of the vacancies and the shortage of paramedics. But we currently have 10 paramedics in school. 6 of them graduate next month. So that will actually help out dramatically. And with hopes of July 1, I can move that station to that split crew model. Goal 2, enhance the professional development of our personnel to meet the needs of our organization and the community. This was kind of put on hold through COVID, but we did start in December of 2021. We got a work group together. They've been tasked with reviewing the requirements, recommendations for the following programs, and that's pretty much, for the most part, what we do, our bread and butter. And then this work group will complete in March of 2023 with recommendations. Goal 3, improve community outreach programs, promote our message to the community. The work group completed a town-wide survey to determine how people prefer or currently get information regarding the town or fire rescue. We're currently working with Hospice, First Presbyterian, Deepwell to get smoke alarms into homes and deliver community risk reduction messages. And we've been working with La Isla to publish safety articles that are relevant to the Hispanic community. I can tell you that La Isla is also, we used it as an outreach for our recruiting, and we were successful. I know we got at least 1 applicant that basically said, my mom saw this in La Isla, basically came to me and said, you need to do this. And then we currently have an outreach program through the school, through a publication in La Isla that the mom saw and is pushing the son to reach out to us. Fire Rescue is implementing a standing committee, which means it's a committee that will not go away. This was a work group to go through the strategic goal, but the work group decided that this is something we need to focus on all the time. So we're going to have a standalone committee that focuses on community outreach. Enhance emergency communications to recognize best practices and regulations to meet organizational needs. So the county recently implemented the EZNet. It was installed on January 12th, which provides the citizens in Hilton Head Island and all of Beaufort County a more redundant 911 system. So if 911 system goes down, this is it's a network of systems that basically allows a redundancy, and it also moves us to the next generation 911, which allows picture and text communication. So if you can't call 911, you can text 911. This was a countywide initiative, so it's in both PSAPs. As I alluded to earlier, to help with our turnout time, station alerting work group is formed to research the station alerting systems and the best options for our department moving forward. This is also a countywide initiative through the CARES Act. However, we do have it in our upcoming capital budget just in case that fell through. We know we need to replace our system. We're hoping and praying and pretty sure that it'll go through with the county, so that'll be good. And then Cad Updates Improvements have been ongoing and have helped to improve the workflow of the dispatchers to provide more efficient emergency response. That is our CAD updates, and what we use in the trucks is a collaboration with Town IT and the GIS department to provide us real-time mapping. Goal 5, improve the quality of EMS care in Hilton Head Island. We're currently finalizing new protocols with our med control physician, with Chief Boothley retiring and basically a whole new division coming in there. We need to let them get their feet under them in the division, so they will have the protocols finalized in this coming fourth quarter of the fiscal year, and we're going to kick off a work group in the first quarter of fiscal year 23. And the last one, enhance information technology systems to support the mission and improve efficiencies. The technology committee that we have, which is a standing committee, they'll monitor IT's progress to inventory all assets and assign a timeline for each product. It'll help us better monitor what items need to be replaced. The committee will review budget items each October to assess the needs going forward. Fire rescue use the new learning management system as a central location. This year we implemented a new learning management system town-wide, records management system for all of our call logs, and a new staffing management for our fire rescue line and dispatch personnel. Our accomplishments, I'm going to kind of focus on the things that Chief covered last meeting, the first half of the year. I'm going to try to just highlight a couple big ones and what we did in the second half of the year. Obviously, the biggest one that's been looming over our heads since pre-Hurricane Matthew, Station 2, we finally moved into in June of 2021, and we are holding the open house roughly around the 1-year anniversary that we've been putting that off because of COVID. But again, thank council for this. It is a beautiful station. We get visitors every day there from Sea Pines that love it.
Nothing but compliments.
Nothing but compliments. It is phenomenal. We completed the RFP for the pumper and quint fleet replacement. KME was fire apparatus was awarded the contract, and construction has begun. And I'm going to say construction has begun. Materials have been ordered. We are in the pipeline for the build. Chief and I and the committee traveled down to Holden, Louisiana for our pre-build meeting, and I can tell you, I was excited when I went. I was even more excited when I left. These are going to be amazing trucks, and they're going to be, the pride of our fleet and representing the town very well rolling down the road. But this is the pumper and the quint concept. And once I get colored pictures, I will share those with you. We continue to work on goals outlined in the strategic plan, as you saw. We finalized our standard to cover community risk assessment. We completed the peer team visit for CFAI accreditation process, which Chief alluded to. We did receive last week, unanimous vote. After the fire program was implemented, this was more of a community outreach program. So we do the fire in the streets, which means we go out and we provide communities with free smoke detector installs, safety plan checks. So what we implemented this last year was after we have a fire. So we had that fire in Caesar's Place. We go out into the community about a week or two after, and we go out and we do basically the same thing. We educate the community on what happened. We explain fire risk, and we also offer smoke installs. We just did one in Hilton Head Plantation after the fire we had, and it was interesting to us how many people had outdated smoke detectors. So we actually did a lot of smoke detector installs that day in Hilton Head Plantation, just because they worked, but they're out of date. Those homes were built in the late 70s, so it's been a very successful program, very well received.
Chief, just going back to equipment for a moment, you talked about new equipment. Is the supply chain affecting ongoing maintenance?
Absolutely. I would say our fleet is still great. The fleet we have is great. They're good trucks. We take care of them. What we see the issue with now is supply. So right now I have a pumper that's out of service for roughly 8 to 10 weeks because a digital readout on the pump panel that you need to pump the fire truck is broken, and it's going to take 8 to 10 weeks to get the part in. So it's just the age of the fleet. They don't make them anymore. No one has any on hand. I've got a ladder truck right now that's been, the aerial part of it's been out of service for 8 months, awaiting a part that has to be custom built. So I would say the supply chain issue is definitely, we ordered pickup trucks, staff vehicles, last July, and they were supposed to be here on Friday. They're not here yet, but, so we ordered them last July, and now they say they're at the dealership. So we're seeing supply chain issues in everything we do. Medical supplies, we have shortages of drugs. That is just a reoccurring theme in pretty much everything we do. We also, Mr. Lennox, you asked about the pandemic plan. Tom Dunn did rewrite the COOP plan this last year with the addition of the pandemic annex. That's in there, and lessons learned. Emergency Management Division coordinated community COVID vaccination and testing events. We implemented the new records management system, LMS, learning management, and the scheduling system. And we put 50 line personnel through EMT or paramedic recertification through an online platform that we hope stays in place. It was developed, actually Chief Boothley, retired from us, was part of it. It was a nationwide recertification tool, an all online thing that he basically coordinated doctors from all over the country to put together to allow people to recert online instead of doing it in person. So it's been extremely valuable for us for the last 2 years. So I hope that doesn't go away. Sending the sirens, always a huge hit. That continued this year. And then some initiatives that we're currently in or are coming up in 2023 is our Rescue One trailer is being replaced. It is currently in build stage. That is our urban search and rescue tractor trailer that we have. It's just the trailer part. It's an old 70s refurbed Coca-Cola trailer that's falling apart, so we're refurbing a new one. The pumper and quit fleet, obviously. We're onboarding 10 new paramedics. They're all currently in class and will all be graduated here in 2022. The station alerting I talked to you about. Emergency management is looking at going through EMAP accreditation. So just like we're accredited through the fire department, the fire department is accredited. We're looking at a specific accreditation for emergency management. Chief Pfister is working with town staff on creating an addressing ordinance that will be coming forward to you. We will continue to monitor COVID and whatever variant or anything pops up from that. We are adding cameras to the medic fleet, so our new pumpers will come with inward and outward facing cameras in the compartment, so you'll be able to see ahead of you and also see inside the cab if anything were to happen. It's a good risk management tool, so we're actually going to add those to our medic fleets. We're creating a fire rescue social media marketing plan. So as part of our recruitment and retention, we realized that we lack in our marketing of our brand, townwide and fire rescue specifically. We know that when people look at a job here, they're gonna go to your social media. We don't have one, so the town manager has approved fire rescue to have its own Facebook page. So as that, we can use that for marketing and recruitment and retention. And with that, we're looking at new recruitment and retention initiatives. Councilman Brown has been instrumental in helping us with that, getting us into the schools. Last week, we had our first presentation with the COIN program there. Very well received, got amazing feedback. We're gonna look at new ways to grow homegrown talent here in Hilton Head. So we have a pipeline into the town and into fire rescue. Chief Pfister and I, next week, will be participating in the career day at Hilton Head High School. And we think there's gonna be good things coming from that. That's it. Any questions?
Thank you, Chief. Comments, questions?
Outstanding report.
Thank you.
Fabulous. I share your concern about response time, and I think a lot of it really has to do with traffic and the increase in traffic. Do you also measure response time by station?
Yeah, we do, yes.
And do you see one location being more difficult to respond than another?
No, I would say our stations, look back way before me, are very well strategically located within the island. We don't feel that there's really a need for any more stations. The placement of it, when we moved Station 4 from the old dog pound to the back gate at Hilton Plantation, when we added Station 7, that's great. We pretty much looked at everything. We've got a couple locations we looked at adding emergency access gates. I know one in Hilton Plantation that we couldn't get approved. But I don't think that there's any one outlying station that is greater distance than what we see in our total response to. That was just the first unit going, where we really see our issue with hitting our total response time when we measure all the trucks is our truck company and our battalion chief, because there's only one of them. So battalion chief is at the Cross Island station, the truck company is at Palmetto Dunes. So if you get an outlet, if you get a call down to South Beach or, Dolphin Head, that's a long response time for a single unit. So, but other than that, no, I think it's all pretty consistent.
Good, good.
Chief, good report, appreciate that. A couple of quick questions. In one of your graphs that showed EMS response during the summer months spiking, I presume that's largely attributed to visitors.
Yes.
What kind of EMS service calls do you have with visitors?
Everything we see with our local population, we see with our
Okay, it's
visitors.
just more people on the island?
Just more people on the island, yep.
Okay. Secondly, if the town is considering a short-term rental unit ordinance, there has been a discussion by some people that the town should require an annual inspection as a part of the short-term rental permit process by the fire department. There are 9,500 units on the island that are short-term rentals. If the town were to consider that, about how many hours or minutes should it take a fire inspection team to review a single unit?
I think, actually, I just found out about this, but Chief, we just talked earlier, we're actually going to meet, I think, this week to discuss that.
Okay.
Good, yeah, just
Well-
so you.
Yeah,
Yeah, that's an interesting question, because at what time of year are people going to be in the home? The sheer number, how long it takes per occupancy. Yeah, there's some things to unpack there, I think, as far.
Okay, I see Ann nodding in the background. She's going to be on it.
Yeah, we'll come up with a
That gives me
number.
confidence. And then one aspect, Ann, and maybe just put this in your head, what would happen if there were voluntary requests for inspections? What kind of burden would that put on fire rescue as well? I've had my other questions answered, so again, fantastic job. I have a high degree of confidence in fire rescue, and you so professionally operate your department. Thank you.
Thank you.
Again, excellent report. We're really indebted to your commitment to service, your professionalism, your interest in staying current with technology, current with what's going on in your profession. So on behalf of the entire community, thank you.
Thank you.
The next item on the agenda is a consideration of a resolution from the Planning Commission recommending Hilton Head Town Council and Beaufort County Council work together on the development of a new long-term agreement that will secure the landfill and recycling needs of Hilton Head Island and Beaufort County. I understand we have an excellent team here to comment. Sean, Peter Christian, Mark Baker. Good morning.
Good morning, Sean Colin, Assistant Town Manager for the record. I guess I should have made it a condition of this position that I never have to follow fire and rescue in a presentation. We've done police, we've done fire, now we're going to talk about trash. Well, at least it's not sewer, right? There's some hope, so. I'll be brief in my comments this morning. I just really want to introduce this item. As the town council has adopted in their strategic plan, an initiative to do a SWOT analysis related to solid waste and recycling. We programmed third quarter of 2022, so it'll be coming up here in a few months to do a deep dive. It's good to see that the community and the town are aligned in a position. Solid waste and recycling was an important element that was outlined in our plan, the town's comprehensive plan, which was adopted a short time ago. And the Greater Island Council has taken the mantle and drafted a resolution. They brought it forward. They adopted the resolution in May of 2021 and brought this forward to the Planning Commission, who supported it with a vote of 8-0 and recommended it be brought forward to council. As you know, Beaufort County manages the public solid waste and recycling program on Hilton Head Island. And they also operate the solid waste citizen drop-off center located at 26 Summit Drive. They also have an agreement with Waste Management as a local landfill operator and are actively working to negotiate a contract that will, to extend the contract that will be served the expansion of Hickory Landfill. I wanted to point out before turning it over to Peter and Mark to make their comments related to the resolution and the path forward. And I've brought up on the screen the town strategic action plan item, and because I think it's the next logical step in this partnership, and give you an idea of what we would be looking at as we move forward in this effort. There's sort of three key components if you look at these bulleted items. You know, there's really an education component to make sure that people understand the benefits and opportunities to recycle, compost, and for litter control. There's also a partnership opportunity, which will involve some type of policy related to long-range plan at the county level with town input. And so that's that dialogue with Beaufort County as we look into this long-range solution for solid waste and recycling. And so that's that second bullet. The third bullet really relates to facility needs. So, you know, as you look at materials recovery, is that what it's called? Let me get this right. Materials recycling facility, transfer centers, landfills, and those other facilities, it's important to make sure that we've got a facility solution as well. And then the fourth one relates to composting opportunities we may have here on Hilton Head Island to help control some volumes that go across the bridge. So the town is ready to engage here later this year, third and fourth quarter, on these initiatives. I think the resolution put forward by the GIC and supported by Planning Commission are in line with those goals and recommendations from our plan. I think they're in line with the path that we've set forward and council's adopted with their strategic action plan. And I'll turn it over to Peter and Mark to go through their comments and be happy to answer any questions at the end of their presentation as it relates to our upcoming effort. Thank you. Peter?
Sean, before you leave.
Yes, sir.
I think maybe committee members might have a question of you.
Yes, sir.
At this stage. Okay, fine, we'll catch you later.
Okay, thank you.
Yeah. Thank you, Sean. Before we go forward, you know my day job is managing Hilton Head Plantation, which is the largest residential community on the island. And I work with Angela's folks, and I work with the Cheeks folks every day. And the level of service and cooperation our staff get with their organizations is just unbelievable. And all of you said that the level of professionalism, it's second to none. And they just do an outstanding job. And they save people's property and they save people's lives, and over again. And that just cannot be understated. And that's almost as important as trash and recycling. There are a lot of moving parts to this, and I'm going to touch on a number of things, and Mark's going to fill in. You know, back many years ago, you put your toe in the water for a trash and recycling program. And for a lot of reasons, it was not successful and needed to be dropped. One of the major reasons it needed to be dropped, or it was dropped, is because it was just not economically feasible. Every truck had to go to the landfill, had to go over that bridge, travel that distance, turn around, and come back. On Saturday, the landfill closes at 2 o'clock. So that put those trash trucks out of business. If they were full, they couldn't offload anywhere. That made it economically a challenge, and that same challenge is today. The other piece, and I've said this to all of you over and over again, is that the county's contract with waste management at the landfill is that they pay to drop off their recycling, and the tipping fee for trash is picked up by the county taxpayers, all of us. It is a disincentive for the trash and recycling folks to recycle because they have to pay for every load. It's tail backwards. The county is presently working on a sustainability campus that'll be south of the Broad, where trash haulers and property owners can bring their solid waste and recycling. The advantage of having a facility like that south of the Broad is obviously it's going to cut down on the time and the number of trips a hauler has to make because they can drop it off there rather than going all the way to the landfill. The convenience centers and also at the landfill, these items of recycling have to be compacted. Right now, when they're taking from the convenience centers, you're transporting 90% air because the glass is in bottles, the aluminum is in cans, the plastic is plastic, it's not bundled. So again, increased transportation costs, fuel costs, pollution, you name it, it's in there. So having that sustainability campus is going to be a huge assistance to make a possible trash and recycling program here again at the residential level possible because it'll be economically more feasible. But that's the first step to get that campus in. Not only is it going to be economically feasible, it's something, if it's done right, can serve as a showplace where people can go to see how this facility operates. It can be a tourist destination. It can also be a place where the county, rather than waste management, can package those recyclable products and market them directly. They can be reduced, bundled, and sold directly to a supplier from that location. Landscape debris can be turned into mulch, it can be turned into soil amendments, and all of those things can be products that are saleable. So what we're asking you to do is to move this to the full council, endorse it, and allow us to work with Beaufort County on moving this first and next step, which is a very, very important step forward. Mike Bennett, who is the principal with I2 Recycle, is your representative up with the county. And he has done an outstanding job. Unfortunately, he couldn't be here today because he had a trash and recycling commitment at the last minute. So another thing I want to bring to your attention, and David, you mentioned this with the short-term rental thing. I've been an advocate for looking at a business license and saying that a third of the folks who short-term rent need to be Friday to Friday, a third Saturday to Saturday, and a third Sunday to Sunday. Make it a requirement in business license. Not only will that reduce traffic and spread it out, and spread out the economic needs of every grocery store, the restaurants, all the way down the line, every one of those units have to be cleaned and the trash taken out on Saturday between 10 o'clock in the morning and 4 o'clock in the afternoon. Think about what it would do to spread that burden out. So I know Mark has a few more comments.
Thank you, Peter. Thank you for giving us the opportunity to come and talk with you today. Waste management really is the key to our community's sustainable practices, and many would say it's the foundation to our sustainable practices. Hilton Head Island is well known for being good stewards of the environment, but honestly, we're not truly sustainable by many measures today, and that would include the way we manage our waste stream, our long-term plans for transportation, energy, water consumption. All of those topics are part of what our Sustainability Advisory Committee has been looking at for many years. One of the first things the Greater Island Council did on the topic of sustainability was create our committee that we've been involved in for many years, which is the Sustainability Advisory Committee. That committee then created an organization called Experience Green. One of the first things Experience Green did was fund and create a baseline sustainability assessment for the community, and it identified all the sustainability topics that we could do better in on Hilton Head Island. I would encourage you to go to the Greater Island Council's website and look at the Sustainability Advisory Committee's section of that website, and you can find that baseline sustainability assessment. What we found, though, when we did the measure for recycling, we found that Hilton Head Island recycles 5% of our waste. Most communities recycle 35% of their waste, so we're woefully behind the national average. It's not just about the way the community presents itself as a sustainable community, but it's about cost. How do we lower the cost for our residents and our property owners? We do that by diminishing the volume of waste that goes to the landfill. Right now, we can reduce that volume by creating this new sustainability campus, and take a large portion of that waste and prevent it from going to the landfill, and create product that has value through good packaging and good sorting. So we would encourage you to support this initiative, and then also think long-term about Hilton Head and how we re-engage a more manageable recycling program for residents on the island. I know when tourists come to the island, they have a difficult time believing that Hilton Head doesn't have an institutionalized recycling program. Wow, what a great sort of outward expression of how sustainable we are. In fact, many tourists, if they don't have a sustainable program at the unit that they stay in, want to bag it up and take it to the center, the convenience center, you have to have a decal to go there, so they can't even take it there. So we need to really be thinking about the way we manage our waste stream. It's very important to our tourism economy. It's very important to us as residents and the way we manage our waste stream. And then start thinking about water and energy and transportation as well. So thank you for giving us the opportunity to come before you today.
Two other things real quick. That sustainability campus will give Beaufort County a better bargaining position when they renew that contract and go into contract negotiations with waste management, because they'll have an alternative.
And that's very important, because
that's a very, very important piece of this. The other thing, and Councilmember Brown brought this up, and we're going to be advocating that the convenience centers, right now you need a decal to recycle, and that discourages folks to recycle. And there should be a way to reconfigure those county convenience centers where if you wish to recycle, whether you're a tourist, a resident, or not a full-time property owner, not eligible for decal, where you can recycle, not use the county services for trash, but recycle. And I think that there should be no barriers to that for anyone to do that. That's just good stewardship.
Thank you. Committee questions, comments?
Is a single convenience center on the island?
It wouldn't be on the island, Tom. It would be south of the Broad.
well, he's
I
talking about
understand
our
that.
convenience
Okay,
center.
I'm sorry.
Yeah.
You mentioned earlier that our convenience center is the most active of all the convenience centers in the county.
True.
Right.
To open up access to our convenience center to any and all, to include tourists.
Just for recycling, not for trash, just recycling.
Need we have a second convenience center?
Maybe, and would that be a bad thing?
We probably
Make it more
would.
convenient.
We probably would, but the real question is there a better way to manage recycling? And I think that's what we're asking town council and staff to look at, and that is, think about the way we manage recycling in our communities. I live in Hilton Head Plantation. I have 3 or 4 trucks come down my street. Is that really the best way to manage our waste collection and waste stream? We need to begin to think about consolidating, making waste and collection of our waste stream, and that includes trash as well as recycling, available to everybody, all residents, so they don't have to go to the centers. And then we should think about, long-term, what do we do with our commercial operations? I mean, think of the amount of glass that's produced in our restaurants and commercial enterprises on the island. That glass is now being captured by a recycling center in Hardyville, and they're grinding the glass and making that available as a resource. So all of the materials we think have value, but we'd like to begin to see that happen at least on the residential level and then ultimately commercial.
Yeah, I think immediately we have a capacity issue on the island.
Right.
From getting to the south of the Broad campus from
Right.
here.
Right,
Correct.
right.
David, please.
Thank you. I support what you're recommending and will vote for it today. I think it's important to this community that we take a significant and committed step in this direction. So I congratulate you on pushing this forward over a number of years.
Thank you.
I'll take this opportunity to again say that citizens on this island are paying a surcharge to have material recycled, and there is no assurance that that is actually being recycled. And I think that it's important for citizens to know that's happening so that they can make the choice as to whether or not they want to continue paying a premium that's not meeting their expectations.
Good point, thank you.
So
We agree.
you mentioned 5% for Hilton Head. Is that because of Hilton Head, the county, or the state? What is that?
Good point, and good question. I think it's low because we have no formal way to collect and encourage our residents. Many communities have waste management services, and then they require that recycled material be separated. We don't do that here, it's optional, so.
Yeah, and David, over 50% of my residents, for survey after survey, you go to the convenience center. And because they don't trust a trash hauler that the recycling is going to end up in the recycling stream.
Yeah.
And that takes a lot of effort, so,
Yeah.
you know, there are many who would just not recycle.
Again, I look towards staff, and Josh in particular, asking for action in that regard. Thank you. Oh, Sean, would you like to add something to that?
To that point, we had reached out to the private haulers because we wanted an assessment of what their recycling practices were. And we sent out a written notification here last week with a request to have that information to us by April 4th. So we'll make sense of that and then provide that to council once we have that. There's a requirement as part of their business license to operate here on Hilton Head to provide that information. So we will establish a baseline and then track that over time to make sure the trends are going in the right direction.
Appreciate that. Thank you.
Thanks, Sean.
Good.
Excuse me, I too, 100% behind this project. A few questions. We're at 5% recycled. Average in the country is 35. What's your expectation that for the future if we were to embark on a state-of-the-art recycle program?
Well, to begin with, the sustainability campus will go a long way to transform the way our commercial enterprise manages waste, because they'll have a transfer station, and as Peter mentioned, won't have to go all the way to the landfill. That's going to reduce their transportation cost, number one. And number two, it's going to encourage them to be, I don't want to say more honest, but to be more.
But you did.
If you flip
and then
the-
many may be managing their recycled material
And if
very
you
properly.
flip the cost, obviously, and charge them for their solid waste, and their recycling would be free, I think you see a lot more recycling
But
being
what we
done.
really want to do is intercept that recycled material at the transfer station and then process it properly.
Yeah, right.
So that glass, aluminum, paper, and all of that is really, you have a very clean waste stream that has value. And it really should start at the source, which means we should have separate containers for glass, paper, cardboard, all of that. Anyway,
And-
so
and the means
if
to
we did
reduce it.
those things, the transfer station is the first step. And then partner with the county to develop zones for countywide waste management and hauling on Hilton Head Island. And the county was engaging commercial vendors to do that outside of Hilton Head Island. We think they would be willing to do it on the island as well, so that you have one hauler in each community, rather than 4 or 5 haulers. And that those haulers then are charged with properly managing the waste stream. They're required, and then monitored. So I think we could make a huge difference. I really do.
If you were to draw an economic circle around the entire process, is this a break even? Is it a loss leader? Or will
It's
it-
not a break even. You don't generate enough money from the sale of recycled materials today, but what you do is you lower your landfill cost.
You lower your cost.
Because right now, Waste Management is getting ready to renew their contract in 2025 for the landfill. Every ton of traffic we deposit in that every ton of waste we deposit in that landfill costs us as residents. We can reduce that cost. So, and they want to take our waste. I mean, you know, it's an incentive to them to have higher volume of waste going in there. We want to reduce that cost because it reduces our landfill cost as residents.
And
when
extends the
you're-
life of the landfill.
When we're speaking to our constituents.
Right.
And they ask, what economic impact is this going to have on me?
Reduces the cost of the landfill. It does have some the recycled material certainly does have some economic value. We know glass, aluminum, cardboard, all of those things have tremendous economic value. Plastic, not as much, but we want to remove that plastic from our waste stream. So the things we do that make us good stewards of the environment and others that we do to make money, but then lowering the cost of the landfill is the big payout. Because right now, Waste Management first said the landfill in the
2020.
Hickory Hill landfill
Yep.
Was at capacity and was going to run out. Now they're saying we can build another cell and create more volume there. Well, what we as a community want to do is reduce that volume and reduce our cost. And then, you know, I mean, there are all the secondary and tertiary impacts, which is less traffic, less
So
trucks.
there's two components of reduced cost. First component is compacted material going to the landfill.
Right.
And the second component would be the actual value,
Value.
albeit
The value of the
small,
commodity.
of
Right.
recycles.
Right, yes. And then the third impact would be the perception of the way the tourism industry and travelers perceive us as a community by being truly
Good stewards.
sustainable today. And the sustainability campus, we think, could be an outward expression of that.
And who's going to build the campus?
The county
Beaufort
has
County.
already got that on their agenda to do. What we would like to see is town council
Really?
get behind the county to do that.
What does that mean?
I think it's on the
They
agenda.
are in negotiations for a piece of property. Obviously, they don't want to identify that property. They have three that I understand that are under consideration. And just as you do not divulge where you're buying property, they're keeping that close to the vest.
So it's happening, and what we would like council to do is to get behind that. and
Endorse it.
staff, and then say, what can we do to make this happen, to move it forward? Very quickly.
Peter and Mark, I think from our standpoint, it would make sense for us to be doing this with Bluffton, in concert with Bluffton. Have you had conversations with Bluffton, or would you recommend that we initiate those conversations?
We haven't, but the
Not a bad
county
idea.
may. I believe the county has.
Well,
but,
your resolution talks about the Greater Island Council of Hilton Head Island and Bluffton.
Yeah.
It is.
So I think that discussion should be initiated by you all,
Yeah.
or the GIC.
Well, my opinion on that is that once this committee, Public Planning Committee, passes it on with a recommendation to endorse the resolution, then we
There may
get it.
need to be some staff outreach between
Yes.
your staff and the Bluffton staff to help us out in that regard.
And what we really want is all the communities in southern Beaufort County to work together with Beaufort County
Yes.
to advance this program. And then ultimately, we'd like to see the county implement a waste collection system that happens in Bluffton, that it happens on Hilton Head, and it happens in unincorporated areas in southern Beaufort.
It's going to be countywide.
Yes, right. So that's the next step, is a waste collection system.
Mr. Chairman, I'd like to make a motion to recommend to council to endorse a resolution from the Greater Island Council put forth by the Planning Commission that the town and Beaufort County work together in the development of a long-term agreement that will secure and landfill and recycling needs of Hilton Head Island and Beaufort County.
Thank you. Is there a
Good, I second, yes.
All those in favor?
Aye.
Thank you.
Thank you, gentlemen.
Thanks for your time.
Good work, thank you for coming forward. Okay, our next item on the agenda is the HUD CDBG Entitlement Program, the 2022 Annual Action Plan Request for Project Approval. Marcy, good morning.
Good morning. Nice
Hey,
to
Marcy.
see you. My first public meeting in person.
Yes, nice to see you again.
Good morning. For the record, my name is Marcy Benson. I'm the Senior Grants Administrator for the town. And today, staff is recommending the committee forward a recommendation to Town Council to select Taylor Family Park as the 2022 Community Development Block Grant Project for inclusion in the town's 2022 Annual Action Plan. Approval of the Taylor Family Park as the 2022 CDBG project in the town's annual action plan will allow the 2022 funding allocation, along with approximately $32,000 from the 2019 funding allocation, to be used for the project. HUD has not yet issued notification of the 2022 CDBG funding allocation amount. I've talked to our HUD representative. He cannot give me a firm date, and I check the HUD website every day to see if they've announced them. So as soon as we know from HUD, I will update everyone on the amount we will get. However, in previous years, the allocation has been approximately $200,000. So it's anticipated that in 2022, the allocation will be at a similar level. And so using this estimate, funding may be approximately $232,000 for the park project. Approval of the Taylor Family Park project is consistent with the current 5-year consolidated plan and also the 2019 annual action plan for CDBG funding, as well as several of our plan goals, strategies, and tactics, which were referenced in the staff memo. In order to meet HUD requirements, public input must be solicited during the development of the annual action plan, and this was met with a CDBG survey posted on the Open Town Hall portal from February 16th through March 2nd, and also a virtual public hearing that was held on February 24th. There were no comments submitted during the virtual public hearing, and there were 3 comments submitted via the Open Town Hall portal, and those comments were summarized in the staff memo. For a little background, the last few years, in 2020, all of the town's CDBG funds were allocated to public services and program administration, and this resulted in the distribution of approximately $730,000 to local public service organizations for response efforts to the COVID-19 pandemic. And in 2021, the Patterson Park project was selected for CDBG funding, and the HUD-required environmental review is currently being conducted for that project. For 2022, which is the program year 3 in the current 5-year consolidated plan, the project category included the flexibility to select projects that could address a broad range of community needs that would benefit low and moderate income residents. HUD does allow CDBG funds to also be used for program administration and public services. However, there are spending caps that are associated with these expenditures, which allow for no more than 20% of the allocation to fund administration costs and no more than 50% to fund public services. The draft of the 2022 annual action plan indicates that $5,000 of the allocation would be designated for program administration costs, and those include items such as publication costs for public meetings and environmental review notices, and then the remaining portion of the allocation would be used for the Taylor Family Park project. Lastly, I'd just like to note that in order to meet the May 16th HUD submittal deadline, the draft annual action plan was released for the required 30-day public comment period on March 14th, and approval of the final plan by resolution is currently scheduled for the May 4th Town Council meeting. I'm happy to answer any questions that you all might have about this item.
Thank you for the presentation. Comments, questions?
Marcy, I think your memo to this committee was very effective in referencing the strategic plan of the town in the goals, strategies, and tactics. It flows perfectly.
Thank you.
I have no questions other than that comment.
I have two questions.
Please.
Not what the public was saying, but what were the other projects that staff considered?
This was the focus was the Taylor project because it is in the proposed CIP budget for 2023, and it is the most advanced as far as it would be in the town program, and we could, once we know that the funding will be available through CDBG, we can start the process to do the environmental review and then more of the detailed plans.
Okay. Mr. Cohen, would you like to make a comment?
Yeah, Marcy doing a great job. Again, Sean Colin. So we vet everything through our capital program. Now that we've got Jennifer leading that significant effort. This property was acquired a couple decades ago. And, you know, one of the strings with the acquisition was that it would be a family or neighborhood park. Probably about a year ago, there was an inquiry, hey, whatever happened to Taylor Family Park? You know, we've had it, it's kind of in the program, but out year. So there was a need to help prioritize this initiative. You know, for a long time, for the first many years, we tried to use CDBG funds for dirt road paving, and then we had a road usage fee, so we no longer needed to just try to pave dirt roads with that money. So we turned to other facilities. We provided facilities at the Boys and Girls Club. We did some at Rowing and Sailing Center. And so Patterson Park was in the queue for the current fiscal year. And it was time for Taylor to kind of come up in the queue. We vetted through CIP Committee, Planning Commission, as far as recommendations. It's included in the 5-year plan. And so while you could consider a few other programs, there are limitations based on low to moderate income census tracts, and therefore this became a logical choice and iteration, and probably long overdue, but we think it's time to move it forward as the project for this annual action plan.
Very good information, I appreciate that. If we move this forward, it becomes a in-house design project, or is it turned over to a consultant? And at what point does the council get involved in that process, if at all? And Jennifer's coming up to help you.
I'll take that one. Jennifer Ray, Capital Program Manager. It's my anticipation that we would use one of our on-call consultants for the design and permitting for that project. And first step will be surveying after you all approve the FY23 budget, and then we'll get one of our teams to get started and bring it forward at the appropriate time in the process for council to have an update.
All right, thank you very much.
You're welcome.
And just one final observation on my part. At one point, the Children's Center was looking at this very property, and I got an opportunity to walk it. It has some very nice trees on it, and I think it has tremendous potential as a neighborhood park. Good job. Thank you.
Thank you. Excellent presentation, Marcy. Is there a motion to proceed and recommend to our colleagues in Town Council?
Bill, I would move that we forward the recommendation as presented to the full Town Council for approval.
Second.
All those in favor?
Aye.
Aye.
So moved.
Thank you.
Ahmad, you're still here. Thank you. Please come forward. Ahmad, you know how to throw a nice party. Congratulations for a successful event last weekend.
Appreciate it.
All right, Jamie Lopko for the record, Senior Planner. We'll get through this as quickly as possible for you. We're looking at the lease of some jointly owned properties along Beach City Road, so we'll go over the recommendation, a summary of the request, the existing master plan and the proposed lease, the location of the 4 parcels in their current conditions, as well as their location in relation to the master plan, the lease terms, and what our next steps would be. So our recommendations is that the committee review the request of Mitchellville to lease the 4 parcels along Beach City Road that are jointly owned by the town and county, and consider forwarding a recommendation to town council authorizing the execution of the lease between the town, the county, and Mitchellville. Execution of this lease is going to allow Mitchellville to utilize those 4 properties consistent with their approved master plan. It is consistent with Inclusive Strategy 2.8 from our plan that allows us to preserve this area for a cultural and historical museum and provide educational opportunities for our residents and visitors. Additionally, this will also allow Mitchellville to move forward with some archaeological work on those 4 properties that they had not been able to do in the past. Town Council approved Mitchellville's master plan in August of 2020, and at that time, the master plan did include parcels that are not currently leased by Mitchellville. And so those additional parcels will be needed for the development develop the park as the Historic Mitchellville Freedom Park, as shown on their master plan. And the draft lease was approved by County Council on May 10th of 2021. This is the existing area. This is an aerial, 4 parcels you can see along Beach City Road, and the outline area in green is the current Historic Mitchellville Freedom Park. So those are the 4 parcels that are under consideration for the lease, and they are jointly owned by the county and the town, and they are heavily treed, just vacant areas at this point. This is the approved master plan, and if you can see on there, there's a hashed red line around the outside of it that included the parcels along Beach City Road. You can see there's developments along the entryway. You can see where there's a little gap. That's the current entryway into the park, and so there's parking and buildings that are planned for that area. The other parcels would have had stuff included on them, but at the time that the master plan came forward, there was discussions of possibly moving St. James there, so they opted not to include anything at that time, but would like to have those parcels to include for possible future development as part of the master plan. So the lease term is going to be similar to the lease that we currently have for the park. It will be a 45-year term with the option to renew for 25 years. Mitchellville will be responsible for all financial obligations with the development and maintenance of the properties, and any of the development that's on those properties would have to be in compliance with the approved master plan and any amendments to that master plan. Now, since the time the packet went out, we had Curtis Coltrane, the town attorney, reviewed the ordinance and as well as the lease, and there's been a couple of changes to the actual lease that I want to bring to your attention and for you to consider as part of your recommendation. And so Article 1.1, he added an option of a non-renewal. It exists in Article 7.3 that they have the option to not renew the lease, but it wasn't referenced in this section, so we just added that reference. At Article 4.1a, we changed the word shall to must. And so this is when they want to bring forward an amendment to the master plan. And basically, we didn't want to infer that town council has to approve what they bring forward. The word shall is very definitive. So we wanted to say that they must bring something forward for consideration. So there's just a change in the words and to make sure the intent leaves, doesn't enforce town council and the county to approve whatever's been put before them. Article 4.3, we added a reference. When they bring forward an amendment, we wanted to be clear that the amendment has to be in conformance with the laws that are in effect at the time of that amendment. Article 5.1 was just a grammatical change, no substantial change to that. Article 7.3, we had a reference in there to a right of entry that was incorrect. It's a lease of the property, not a right of entry. And so if the property were to be abandoned, they would be evicted from the property and not eliminating the right of entry. So it's just a change of a reference for that to make sure it's correct legally. And lastly, Article 8.4, we referred to a sublet, but it was referred to a sublet of a lease, which is incorrect. You're actually subletting the property and not the lease. So again, we just corrected the terminology for that. And lastly, our next steps, we have the recommendation coming from the committee today. If approved, it would go forward to Town Council as early as April the 19th. And if approved by Town Council and the county, we would execute and record the long-term lease with Historic Mitchellville Freedom Park. And I'm available for questions, and of course, Ahmad is here as well, Executive Director of Mitchellville, if you have questions.
Thank you. Ahmad, any other comments?
Just that we're excited about the opportunity to do this. It gives us an opportunity to reach into more areas that would be historic Mitchellville and allow us to increase our interpretation when we get the park running. So we're thankful for the opportunity to look at this adding to our space.
Committee comments, questions?
Good. Jamie, has the county seen this yet?
Yes, the county actually initiated the lease and approved it in early 2020, May of 2020, I believe.
So they're waiting on us,
Yes.
okay? And Ahmad, this gives you opportunity to amend your master plan.
Absolutely. So this is great for us. We were excited to partner with the town and the county to try to make room for the church to come in. Since that is not happening, then we have an opportunity now to expand our interpretation to go towards Beach City Road, so it works in our favor.
Well done.
David, please.
This is all opportunity, and even beyond that, it's almost mandatory for the quality development of Mitchellville. So I'm green lighting this from my standpoint.
Thank you.
So is there a motion to move forward with a recommendation to our colleagues in Town Council for the lease of a jointly owned land by Beaufort County in the town of Hilton Head with the historic Mitchellville Freedom Park with the legal updates as presented this morning?
Yes, there is.
And a second.
All those in favor?
Aye.
So moved. Thank you for the good work.
Thank you, gentlemen. Appreciate it.
I believe we have no other items to come forward.
Move for adjournment?
So
Second.
moved. We stand adjourned. Thank you. And thank you.